Tonsillitis, a frequent visitor in the landscapes of childhood, is no stranger to many. This ailment, characterized by the inflammation of the tonsils, is often a source of discomfort and worry for parents and children alike. The tonsils, two small, oval-shaped pads of tissue at the back of the throat, are part of the lymphatic system, which helps fight infection. When these guardians of our immune system become inflamed, it results in the familiar symptoms of tonsillitis. Understanding this common condition, its causes, symptoms, and treatments is key to effectively managing it and ensuring a speedy recovery. Tonsillitis often announces its arrival with a sore throat, difficulty swallowing, and swollen tonsils, sometimes accompanied by a telltale white or yellow coating. While it can affect people of all ages, tonsillitis predominantly targets children and adolescents, coinciding with their developing immune systems. This period of immune system maturation presents a greater susceptibility to the viruses and bacteria that often trigger tonsillitis. The good news is that most cases of tonsillitis are acute, meaning they are short-lived and resolve within a week or two. However, in some instances, tonsillitis can become a chronic issue, leading to repeated episodes and potentially necessitating surgical intervention. This essay aims to shed light on the various facets of tonsillitis, empowering readers with the knowledge to identify, manage, and seek timely medical attention for this common ailment. Tonsillitis arises when the tonsils, those vigilant sentinels guarding the entrance to our airways, become overwhelmed by invading pathogens. The most common culprits behind this inflammation are viral infections, with the usual suspects being the common cold and influenza viruses. These microscopic invaders hijack the cells of the tonsils, triggering an inflammatory response that manifests as the characteristic swelling and soreness. While viruses are the primary instigators of tonsillitis, bacterial infections can also play a role, with the bacteria Streptococcus pyogenes, or Group A strep, being a notable offender. Strep throat, as it is commonly known, requires prompt antibiotic treatment to prevent potential complications. Other bacteria, such as Staphylococcus aureus and Haemophilus influenzae, can also contribute to tonsillitis, though less frequently. Beyond infectious agents, certain lifestyle factors can increase an individual's susceptibility to tonsillitis. Exposure to cigarette smoke, for instance, can irritate and inflame the tonsils, making them more vulnerable to infection. Similarly, allergies can lead to chronic nasal congestion and postnasal drip, which can irritate the tonsils and increase the risk of tonsillitis. Maintaining good hygiene practices, such as frequent hand washing and avoiding close contact with sick individuals, is crucial in minimizing the risk of contracting the viruses and bacteria that cause tonsillitis. Boosting the immune system through a healthy diet, regular exercise, and adequate sleep can also bolster the body's defenses against these microscopic invaders. Tonsillitis often announces its presence with a constellation of symptoms that can range from mild discomfort to severe pain. Perhaps the most telltale sign is a sore throat, which can vary in intensity from a scratchy sensation to a sharp stabbing pain that makes swallowing a dreaded ordeal. Accompanying this throat discomfort is often difficulty swallowing, forcing sufferers to alter their diets and rely on softer foods. Upon visual inspection, the tonsils may appear red and swollen, sometimes with visible white or yellow patches of pus. These patches, while alarming in appearance, are simply a sign that the body is actively fighting off the infection. Swollen lymph nodes in the neck, another indication of the immune system's battle against the invading pathogens, can be felt as tender lumps beneath the jawline. Beyond the localized symptoms in the throat, tonsillitis can also manifest with a range of systemic effects. Fever, often accompanied by chills, is a common occurrence, as the body raises its internal temperature to combat the infection. Headaches, body aches, and fatigue are other frequent companions, leaving individuals feeling drained and miserable. In some cases, particularly in younger children, abdominal pain and vomiting may also occur. Recognizing these symptoms is crucial in seeking timely medical attention, as prompt diagnosis and treatment can alleviate discomfort and prevent potential complications. While many cases of tonsillitis resolve on their own with supportive care, certain red flags warrant immediate medical consultation. These include difficulty breathing, severe throat pain that hinders swallowing even liquids, a stiff neck, and a high fever that persists despite over-the-counter fever reducers. Diagnosing tonsillitis typically begins with a thorough physical examination, during which a healthcare provider will visually inspect the throat, feeling for any swollen lymph nodes in the neck. The doctor will inquire about the patient's symptoms, including the duration and severity of the sore throat, difficulty swallowing, and any associated symptoms like fever, headache, or body aches. To determine the underlying cause of the tonsillitis, whether it be viral or bacterial, the doctor may perform a rapid strep test or throat culture. The rapid strep test involves swabbing the back of the throat to collect a sample, which is then tested for the presence of group A strep bacteria. This quick and relatively painless test provides results within minutes, allowing for prompt initiation of antibiotics if strep throat is confirmed. A throat culture, while taking longer to yield results, offers a more comprehensive analysis of the bacteria present in the throat. This test involves swabbing the back of the throat to collect a sample, which is then placed in a special dish to encourage bacterial growth. The culture is then examined to identify the specific type of bacteria present, guiding antibiotic treatment if necessary. In some cases, particularly when the diagnosis is unclear or complications are suspected, the doctor may recommend a complete blood count, CBC, or other blood tests. These tests can help assess the body's immune response to the infection and rule out other potential causes of the symptoms. Imaging studies, such as an X-ray or CT scan, are rarely necessary, but may be employed to visualize the extent of the inflammation or rule out complications, like a peritonsillar abscess, a collection of pus that forms near the tonsils. Section 5. Combating tonsillitis. Treatment options. The treatment approach for tonsillitis hinges on the underlying cause, with viral and bacterial infections requiring different management strategies. For viral tonsillitis, which accounts for the majority of cases, treatment primarily focuses on alleviating symptoms and supporting the body's natural healing process. Over-the-counter pain relievers, such as acetaminophen or ibuprofen, can help reduce fever and ease throat pain. Gargling with warm salt water, a time-tested home remedy, can provide soothing relief from throat irritation and inflammation. Staying hydrated by drinking plenty of fluids, especially water, is crucial in thinning mucus and preventing dehydration, which can worsen throat discomfort. Rest is paramount, allowing the body to conserve energy and direct its resources towards fighting off the infection. Bacterial tonsillitis, on the other hand, necessitates antibiotic treatment to eradicate the infection and prevent complications. Penicillin, administered orally or by injection, is the antibiotic of choice for strep throat. For individuals allergic to penicillin, alternative antibiotics, such as erythromycin or azithromycin, may be prescribed. Regardless of the underlying cause, certain lifestyle modifications can complement medical treatment and promote healing. These include adopting a soft food diet to minimize throat irritation, avoiding smoking and secondhand smoke, and using a humidifier to add moisture to the air, which can soothe inflamed throat tissues. Over-the-counter lozenges and throat sprays can also provide temporary relief from throat pain and discomfort. Section 6. When tonsils become a recurring nightmare, chronic tonsillitis. While most episodes of tonsillitis resolve within a week or two, some individuals experience recurrent bouts of this inflammatory condition. Chronic tonsillitis, defined as multiple episodes of tonsillitis within a year or persistent symptoms despite treatment, can significantly impact quality of life. This relentless cycle of inflammation and discomfort can disrupt sleep, impair appetite, and lead to missed school or work days. Several factors can contribute to the development of chronic tonsillitis. In some cases, the tonsils may become enlarged or harbor deep crevices, known as crypts, which can trap bacteria and debris, making it difficult for the body to effectively clear infections. This creates a breeding ground for pathogens, leading to repeated episodes of tonsillitis. Immune system dysfunction can also play a role in chronic tonsillitis, as a weakened immune system may struggle to effectively combat infections, allowing them to linger and recur. Underlying medical conditions such as allergies, asthma, or gastroesophageal reflux disease, GERD, can also contribute to chronic tonsillitis by irritating and inflaming the tonsils, making them more susceptible to infection. Managing chronic tonsillitis often involves a multi-pronged approach, addressing both the underlying causes and the recurring symptoms. Lifestyle modifications such as quitting smoking, managing allergies, and treating GERD can help reduce inflammation and minimize the frequency of tonsillitis episodes. In some cases, a long-term course of low-dose antibiotics may be prescribed to suppress bacterial growth and prevent recurrent infections. Section 7. Beyond antibiotics, exploring alternative therapies. While conventional medical treatments such as antibiotics and pain relievers play a crucial role in managing tonsillitis, alternative therapies can offer complementary support in alleviating symptoms and promoting healing. These therapies, often rooted in ancient healing traditions, harness the power of natural ingredients and holistic practices to address the body's innate ability to heal itself. Herbal remedies, with their long history of medicinal use, can provide natural relief from the discomforts of tonsillitis. Gargling with warm water infused with salt and turmeric, a potent anti-inflammatory agent, can soothe throat irritation and reduce swelling. Slippery elm, another herbal remedy, forms a protective layer over mucous membranes, easing throat soreness and facilitating swallowing. Honey, nature's liquid gold, is renowned for its antibacterial and antiviral properties, making it a valuable ally in combating tonsillitis. Consuming a spoonful of raw honey or adding it to warm water or tea can coat and soothe the throat, providing relief from pain and irritation. Probiotics, found in fermented foods like yogurt and sauerkraut, can help restore the balance of beneficial bacteria in the gut, supporting immune function and enhancing the body's ability to fight off infections. Essential oils extracted from aromatic plants offer a natural and aromatic approach to alleviating tonsillitis symptoms. Diffusing essential oils like eucalyptus, peppermint, or tea tree oil can help open up airways and loosen mucus, easing congestion and promoting clearer breathing. These oils can also be diluted in a carrier oil, such as coconut or almond oil, and applied topically to the chest and neck to relieve congestion. Section 8. The decision for tonsillectomy, weighing the pros and cons. In cases of chronic or recurrent tonsillitis that prove resistant to conservative treatment measures, surgical removal of the tonsils, known as a tonsillectomy, may be considered. This procedure, once a common childhood rite of passage, is now reserved for situations where the benefits clearly outweigh the risks. Tonsillectomy is typically recommended for individuals experiencing 7 or more episodes of tonsillitis in a year, 5 or more episodes per year for 2 consecutive years, or 3 or more episodes per year for 3 consecutive years. Tonsillectomy offers the benefit of permanently eliminating the source of recurrent infections, providing lasting relief from the cycle of tonsillitis and its associated symptoms. This can significantly improve quality of life, reducing school or work absences, improving sleep quality, and restoring a sense of well-being. However, like any surgical procedure, tonsillectomy carries inherent risks and potential complications. Bleeding is a concern, both during and after surgery, and while rare, can be serious in some cases. Infection is another potential risk, as is the possibility of adverse reactions to anesthesia. Postoperative pain, particularly during the first week or 2 after surgery, is common and can range from mild discomfort to severe pain requiring prescription pain medication. The decision to proceed with tonsillectomy is a personal one, made in consultation with a healthcare provider, weighing the potential benefits against the risks and considering individual circumstances. Factors influencing this decision include the frequency and severity of tonsillitis episodes, the impact on quality of life, the presence of any complicating factors, and the individual's overall health status. Section 9. Understanding for effective management, the power of knowledge. Tonsillitis, while a common and often easily treatable ailment, can nonetheless cause significant discomfort and disruption to daily life. Understanding the causes, symptoms, and treatment options for this inflammatory condition empowers individuals to take an active role in managing their health and seeking timely medical attention when necessary. Recognizing the early signs of tonsillitis, such as a sore throat, difficulty swallowing, and swollen tonsils, allows for prompt intervention, potentially shortening the duration of the illness and preventing complications. Distinguishing between viral and bacterial tonsillitis is crucial in guiding treatment decisions, as bacterial tonsillitis requires antibiotic therapy to eradicate the infection. Beyond medical interventions, adopting a holistic approach that incorporates lifestyle modifications can bolster the body's natural healing capabilities and minimize the recurrence of tonsillitis. Practicing good hygiene, maintaining a healthy lifestyle, and exploring alternative therapies can complement conventional medical treatments, promoting overall well-being. Knowledge, as the adage goes, is power. By arming ourselves with a comprehensive understanding of tonsillitis, we can navigate this common ailment with confidence, minimizing its impact on our lives and those of our loved ones.